Integrity EMR is a medical record system that's devoted completely to ophthalmology. And that creates a large advantage in that it can specialize its approach to the way an ophthalmologist works. We started with Integrity in November last year. We've had a long history of EMR. My father actually put one in my office in about 1989. So we actually have had nowhere to store charts, and I've been through a number of EMR systems up to this point. I think one of the great things is with Integrity is it is really designed for workflow, and it's a very, very simple interface. And with some of the other EMRs I've worked with, you just had to keep flipping pages, you had to keep flipping drop downs, and it was extremely time consuming to get the information on. When you open up Integrity on the home page, it's your home page as the provider, and it shows you all the appointments that are there for the day. And basically it sort of has a dashboard appearance. And in that dashboard appearance, you can see the charts that you haven't completed and the work that you need to do. It also has an internal messaging system that flags up onto that page so that technicians can send you a message or we can text about patients there. Then once you go to the exam, what I really, really like about the exam is that it is all on one page. So it was designed so that it fits on a single screen. You don't have to scroll on a normal computer. You see everything you want. It has all the exam on there. It also has a doctor review page where you can go and look at the chief complaint, the visions, and the pertinent information very quickly and decide if you need to go through each history panel for some reason more in depth. It's cloud-based, and it's been one of the best things that I've liked about it, because no matter where I am, if somebody calls me, whether it's a patient, a referring doctor, I can look up at their chart from anywhere. I can literally look it up on my iPhone. One of the other features that's really strong in Integrity is what they call IntegraView. And IntegraView is basically their proprietary image management system. And this allows basically the images that you take from all your diagnostic devices to be uploaded into the patient's record that day. And even when you go to send, for instance, your correspondence to the optometrist, you have a choice of sending all the scans that are in the visit for that day or not. But it's very easy to review those scans, and it's really great having them in the same software program and not having to run dual programs to manage your images. The other thing that's really strong in Integrity is its ability to communicate with outside providers. When you get to the last page in the impression and the plan, you simply go down to the bottom to notify provider. We use their web-based fax system, and essentially once I submit my chart with the coding and everything, a letter to the provider or the referring doctor is immediately faxed out of there and immediately received by the other doctor. And what it does is, by the way that it selects history questions and comes down, it then takes that information and puts it in a paragraph normal writing style for you. The other strong part in terms of coding is that there's a coding engine in Integrity, and at the end it gives you a suggested coding which you may choose to accept. You also can question it. If you push on details, it'll tell you why it got that coding, and if you need to modify it, you can. And once again, once you assign the coding, hit the submit button, it transfers to the practice management software immediately. My staff has really liked Integrity. You know, with all EMRs, there's always a learning curve, and there's always a frustration in the beginning as you try to learn. But having implemented 2 or 3 systems before this, I found that the learning curve with Integrity was very intuitive and very fast for the staff as well as for the physicians. There have been some challenges in its integration with the practice management software. And I think those are challenges that are there for all systems, unfortunately. One of the systems I used in the past was a fully integrated PM and EMR system, and I did find that was a little bit better integration than when you're putting something on. But one of the advantages of Integrity is that you can link it with any practice management software. And I think that our implementation issues with Integrity have been minor for the staff compared to other systems that we integrated.